able to afford. And I also mean, perhaps the most important piece, folks with a quality, affordable Medigap plan don't have to spend their remaining months, their remaining days focused on fighting insurance, fighting red tape, and worried staying up at night about the mountain of medical debt they're going to leave behind them. They instead get to focus their last months and days on their families, on their friends, on the things that are really, truly important. So Elizabeth went through a lot of the details of this plan, and I'm not going to rehash those points, but there are a couple additional angles I would like to bring up. One, as Elizabeth mentioned, the projected cost of this on the entire Medigap population is very small. I believe it's 0.9%, and that should be taken in context. Every year, on average, Medigap plans here in Kentucky go up by somewhere between 3 to 4 to 6 to 8%. It just kind of depends year by year and plan by plan. And I know this because I reached out to an insurance broker and asked for price histories on some of the major Medigap plans here in Kentucky. And I'll tell you, I'm reading down the list, and this is information that should be in your packet in my written testimony. You can see that some plans, Aetna, for instance, in 2019, they went up 9%, 2020, 6%, 2021, 8%, 2022, just 2%, so that's pretty good. Other plans, Guaranteed Trust, for the last 4 years has gone up by double digits every year. So if we're talking about this bill having an impact of 0.9%, it has to be taken in context of the expected premium increases which are regularly rolling down the road. And that brings up another point. There's an element in this bill that would allow Kentuckians on Medigap to switch carriers, not switch plans. They can't go from a less generous plan to a more generous plan. But let's say, for instance, you were on you had a Medigap carrier that you chose when you had turned 65, or in this case, when you were diagnosed with a disease, you are locked into that carrier. Well, if you see 5 years in a row of double-digit price increases, you might want to use your ability in a market to go find another carrier within the same lettered plan. So you can go, say, from an Aetna Plan G to an Anthem Plan G or something like that. It does not allow for increasing your level of care so that you can't delay paying for insurance you're going to need, but it does create a market incentive for insurers to keep their plans low and gives Kentuckians freedom to move within different insurance carriers. And finally, I want to bring up some comments that I received via email and then last night over the phone from a woman named Katie Adams. Katie is a 39-year-old single mother of two living in Henderson, Kentucky. She spent her career as an occupational therapist, and this past October she was diagnosed with ALS. Now, during her career, she spent her time dealing with insurers often for her patients that she was helping as an occupational therapist. She says it has now become her full-time job. Her full statement, which is a couple of pages long, should be in your packet, but I do want to read a few of her words to you because I think they're just that important. And these are in Katie's words now. I was diagnosed with ALS on October 28th, 2022. As you can imagine, my life has been completely turned upside down. I want to focus on the life I have left and living it. Unfortunately, having to deal with insurance battles has become my full-time job. I have spent much time and energy on dealing with and figuring out insurance instead of spending time with my loved ones and enjoying what time I have left. Please, I am begging you, please consider changing the regulations that are in place that prevent Kentuckians, especially those disabled and under the age of 65, from having better options for supplemental insurance programs. When I was talking to Katie last night, she said she would be watching today. I'm going to let her know how this hearing goes. I really hope we'll have your support for this bill. Thank you very much.
Thank you. Thank you to each of you. We do have others that will come and speak and testify for, and one who opposes. But before this panel steps away, Representative Bray has a question.
Thank you all. I remember the bill from last year, and obviously a lot of it's changed. This is something that has personally affected my family. Like I mentioned last year, my dad gave a kidney to my aunt who was in renal failure. So I'm very sympathetic to it. I guess my question has to deal, one of the issues I had with the bill last year was you could renew after the age of 65. And do I understand it correct that you all have removed that portion?
I'll let Elizabeth talk about that.
So that's in the birthday rule for individuals who are over the age of 65. And like Alex explained, they have an opportunity around, for a short period of time, guaranteed issue around their birthday, where they can change insurance companies, but they have to stay with the same lettered plan. And that provision is in there so that Kentuckians can find an insurer that those premiums better fit with their financial situation.
Okay.
And so, yes, that has been changed from last year.
Okay. And then kind of on the I guess it's the health mandate or the impact and the actuarial finance statement. You know, we don't have that. I know last year in the bill it was indeterminable what the cost of the bill was. Do you all, and you had said it would increase possibly by 1%. And you had mentioned, I'm sorry, I didn't catch your name, but you had mentioned that you had the actuarial statements.
Yes.
So 1%, how many dollars are we talking on this?
About $2 a month across the entire pool.
And it's worth noting that folks on Medigap pay for their own coverage. These are not state dollars, these are not federal dollars, these are private dollars from the folks who are being insured. And it's also worth noting that we can be confident in this bill because it's already on the books in 14 states. This is as road-tested a policy as you're going to find. This isn't something we think will work. This is something we know works.
Thank you.
Representative Wildner?
Thank you, Mr. Chairman. Thank you, Rep. Moser, for bringing this bill. I remember you and I worked on this together last year and brought this before the committee, and same folks came and testified for it. I was originally hoping it would be a broader regulation of the Medigap so that it would benefit older Kentuckians as well. But I still appreciate this bill. I remember that it passed, I think unanimously, did you say, out of this committee? And then it was referred back to banking and insurance, as I recall. And I had a really unusual experience in the hour or so before this meeting today, and I thought it was worth mentioning, where I talked to two different lobbyists who told me very, very different information. And so I heard from one lobbyist that this would cost older Kentuckians an additional $1,200 a year on their policies, or would, could very well. I was also told that only 3 states had this on their books and it had made significant changes. And then I spoke with Elizabeth, who shared the information that you've just shared here. So I've honestly, this is my 5th year here, I've never had that experience of right before a hearing to hear wildly different facts and numbers and information. So it was troubling. I remember the discussions we had last year, and I was able to meet with you more at length. And it's, all coming back to me now. So I do support this, but I'm concerned that there are these kind of wild disparities in the information that's being shared. And I would hate to see this meet the same fate that it did last year, where, we pass it and then it goes somewhere to die. So I don't know what we do about that. I'm just sharing that observation, but I will be voting yes on this today.
Thank you for that information, Rep. Wilner. I appreciate that. We have asked all of the health plans for data around this and have not received any to date. I did see AHIP sent out late last night. I think it was about midnight that I was reading it. About 200 pages of data that really didn't address just this issue. It was very broad. So we've asked to hone in on that data, and perhaps they have come today with something I haven't heard. But these are all studies which have been done that are specifically addressing this very issue and the exact same legislation that's been passed in other states. So thank you.
Thank you.
Thank you, Representative Moser. If you would just stay close by, as I'm going to allow the other guests to come and testify briefly. I'd like to ask Scott Brinkman and Tom Stevens, if they would, make their way to the testimony table, along with Rusty Kress, as he will speak in opposition to the bill. When When you gentlemen are ready, if you would, just state your name for the record and you may begin.
Thank you, Chair Dotson. My name is Tom Stevens. I'm president of the Kentucky Association of Health Plans.
And I'm Scott Brinkman. I'm with Connecting the Dots Policy Solutions, representing the Kentucky Association of Health Plans.
And Rusty Cress with Dinsmore and Shoal, representing America's Health Insurance Plans.
So we appreciate the opportunity to be here today. In addition to what AHIP may have sent last night, we also sent a copy of the letter that we shared with Chair Mosier to members of the committee, and you should have that. We look forward to the opportunity to hopefully provide some additional clarification today, because we do believe that this bill could shift cost to senior citizens. With that, Scott, I'll turn it over to you.
Yes, thank you. A couple of preliminary comments, and yes, we have worked with the plan sponsor, and a couple of the concerns that I registered last year on House Bill 430 have been addressed, so I appreciate the assistance and cooperation of the chair of this committee in helping to shape the bill in ways that I think are very beneficial. There are two parts to this bill. I'd like to speak to both parts. The first part does affect the non-age eligible Medicare beneficiaries, particularly it's the two proponents that testified. It does represent people with severe kidney disease, end-stage renal disease, and then the Lou Gehrig or ALS population. And certainly we have the utmost empathy for anyone who is afflicted with either of those conditions. The proponents acknowledge that there is a shifting of cost, because there will be a discrepancy between the costs associated with these individuals and the premiums they pay in the MedSup market. As a preliminary matter, the MedSup market in Kentucky works extremely well. We have 54 insurers who are authorized to offer MedSup policies in the state, offering hundreds of policies. There's 225,000 Kentuckians of age eligible who have MedSup policies. So we have a significant percentage of our population who participate in this market segment. Surveys have indicated there's a very high degree of satisfaction among this population with their MedSup policies. So it's a market that works extremely well for a significant number of Kentuckians. As you all know, you are the ultimate policy-making institution in the state. You're asked to make hundreds of policy decisions every year. This is one of them. There are costs associated. There is a discrepancy between the premiums that would be charged and the costs associated with providing appropriate health care to this population, the end-stage renal disease and ALS population. Those costs may be absorbed by the plans. They may be passed on to the age-eligible Medicare beneficiaries. 225,000. Representative Bray correctly noted there is no financial impact statement associated with this legislation prepared by the Kentucky Department of Insurance. There are all sorts of figures. If you accept the figures offered by the proponents at $2 per month, additional cost to the age eligible, that's $24 a month times 225, that's $5.4 million. So there are costs and cost shifting associated. It's a decision for this committee to make in terms of whether you think that's appropriate or not, but I think it is fundamental that there will be some shifting of costs to the age eligible population through House Bill 345. The second part of the bill is what's called the birthday rule, and 6 states have adopted this, the birthday rule: California, Oregon, Idaho, Nevada, Louisiana, and Illinois. So you have blue states, red states, purple states. What's interesting is the birthday rule is essentially a form of guaranteed issue. As we all know, the Affordable Care Act, or otherwise known as Obamacare, has a couple of central components, two of which are guaranteed issue and community rating. This is a form of guaranteed issue. Interestingly enough, the Obama administration and the Congress, when Obamacare was adopted, chose not to incorporate this particular rule in the federal legislation. So in essence, what House Bill 345 does is basically kind of expand Obamacare into Kentucky by adding this guaranteed issue rule in the MedSup market segment. I have done, and again, there's no financial impact statement, so I don't know the position of DOI. I have done extensive research trying to find credible sources of information upon which I could
perhaps form reasoned opinions as to the probable financial consequences of adopting the birthday rule and incorporating it into the Kentucky Med Sup market segment. I couldn't find it. I think so. I don't have any hard data. But again, anytime you add guaranteed issue, you're going to have winners and losers, and I can't quantify how that affects the 225,000 Kentuckians. Again, you are the policy-making institution in the state. This is a policy decision. I suspect that there will be winners and losers by adopting and incorporating the birthday rule into this market segment in Kentucky. But I just simply do not have information, nor apparently does our Department of Insurance in terms of estimates of the financial impact of the birthday rule. With that, I'll entertain any questions from the committee.
And Mr. Chairman, it's awful pleasant to have Scott do all my talking for me, because he did. I have no echoes other than we were going to hit the premiums and the cost-sharing aspect of it. The email that was sent to you by me yesterday at 6:30, it should have only been 3 pages. I hope I didn't put too much in there that wasn't related. But I'm here to answer any questions on that, and if I can't answer them, I'll get you the answers.
I do have a question, Representative Bentley.
I don't know. It's been adopted in 6 states, and then Missouri's been referenced. They have what's called the anniversary rule, which is essentially the birthday rule. They simply provide this ability to shift insurers upon the anniversary of first enrolling in Medicare. So it's essentially the same. But Representative Bentley, I don't know who first wrote it, but it is a form of guaranteed issue.
Thank you. Thank you, Mr. Chairman.
Any other questions? Representative Raymer?
Hi. So you said if we accept the data from the proponent, so I'm sure you've seen the same data that I've seen that looks at the other states and looking, like we've talked about Missouri. I mean, I'm looking at their change from after they implemented this, and from 2007 to 2010, a 2.9% change. And that same time, Kentucky had a 2.4% change and increase. So why do you not accept that data?
Well, I said that the proponents suggested that the impact would be $2 per month per member, which is $24 a year, and we have 225,000 roughly age-eligible Kentuckians. So I do accept the data in terms that to offer to this committee that if you do the multiplication, that's 5.4 million of basically cost shifting from one discrete population to a much larger population, the age eligible, which is the 225,000. So I accept that. And I don't have data to counter that, so I'm going to accept that. But the point I'm making, and for the benefit of this committee, so that you can make fully informed decisions, is this is a form of cost shifting. And so you're shifting costs from a population that was suggested to be roughly 1,500 Kentuckians to a population of 225,000 Kentuckians. It's a form of cost shifting, and that's for the committee to consider in terms of this legislation.
Just a follow-up. So can you tell me, so on average, does Kentucky see these types of policies increase each year?
Yes, they do because of age. You're allowed to, as you age once you've enrolled in a Med Sup policy, the premiums do tend to go up because of age.
And so looking at what other states have done, they really haven't gone up substantially of what they would have gone up anyway.
Correct. Okay. I mean, again, that's...
Thank you.
Okay.
I have one comment, Chair Dotson. We have had the discussion on 14 states versus 3 states. The issue that we have, and I believe it's the guaranteed issue component, which would be the exact same language from the bill. It's our understanding there are 3 states that have that. And I think it's Connecticut, Maine, and New York. Versus in our research, when we were trying to look specifically at Missouri and reaching out to our colleagues there, we couldn't find, there may be legislation running this year, but we could not find the exact same bill language.
Okay. Thank you. There are no more questions at this time. I'd like to have Representative Mosier, if she would, come back to the testimony table.
Thank you, Mr. Chairman, members of the committee.
Thank you. Thank you, gentlemen, for coming today. There is no more questions.
If I could just quickly make a quick comment about the cost shifting. It's interesting to think about that because if we're talking about $5 million in being shifted to this 225,000 member pool, I think we should also discuss the possibility of these members spending down their assets and going on to Medicaid at $18,000 per year times 1,514 dual eligible members. That is $27 million spent in Medicaid. So that's a significant cost shift to those same 225,000 individuals who are taxpayers. So that's what I want to think about. This is not about who's paying what, and I think that we want to make sure that we're providing care and to these individuals who have significant disabilities and debilitating diseases, ALS and end-stage renal disease, who are trying to live their life for the short time that they have left and not be a complete burden to their families or to taxpayers. So they're paying their premiums. We're not asking for the state to pay their premiums. We're allowing the insurers to allow them to have this coverage.
Right.
So that's all I'll leave you with.
Great point.
Thank you.
Seeing no more questions, we'll go ahead and take the roll. I need a motion. And a second. I got a second. Mr. Clerk, would you please take the roll?
Representative Bentley?
Yes.
Representative Bratcher?
Yes.
Representative Bray? Representative Burke?
Yes, and I need to log my attendance, and I'd also like to record my other votes.
We're going to do this right after
Thank you.
this vote.
Representative Callaway?
Yes.
Representative Dotson?
I'd like to explain my yes vote. You know, this is not only a good piece of legislation, but when it hits really home to you, my neighbor, Bill Thyree, over the last few months has been diagnosed with ALS. A very strong man, a man that helped me take care of my property, and just a wonderful man. And to see his decline and to see what he's dealing with and what his family's going through and how this piece of legislation could help him, it will be very impactful. So I vote yes for you today, Bill Thyree.
Representative Duval?
Yes.
Representative Frazier Gordon?
Yes.
Representative Justice?
Yes.
Representative Neighbors?
Yes.
Representative Rayburn? Representative Raymer?
Yes.
Representative Riley? Representative Rourks?
Yes.
Representative Sharp? Representative Swan?
Yes.
Representative Weber?
Yes.
Representative Wilner?
Yes.
Representative Whidden?
Yes.
Chair Mosier?
Yes.
House Bill 345 passes, 17 yeses, 0 no votes, and the same should pass on the House floor. Thank you, Representative Mosier.
Thank you. I appreciate it.
And also, before we adjourn, we're going to recognize those that need to come in and do their attendance and also their votes.
Thank you, Mr. Chair. Representative Lindsay Burke registering my attendance and my votes as follows. I vote no on House Bill 101. I vote yes on House Bill 156. Yes on House Bill 176. Yes on House Bill 196. Yes on House Bill 311. Yes on House Bill 349. And yes on 391. Thank you.
Thank you. Representative Weber?
Mr. Chairman, I want to record my attendance, and I also want to record yes votes on the following bills: House Bill 101, House Bill 156, House Bill 176, House Bill 196, House Bill 311, House Bill 349, and House Bill 391.
Thank you. Is there any others? Representative Mosier.
I'd like to register a yes vote on House Bill 349 and a yes vote on House Bill 391, please.
At this time, we'll take a motion for adjournment.
So moved.
Second. We are adjourned.